Now to the surge in flu cases across the United States and here in Georgia, where the Centers for Disease Control and Prevention says flu activity is very high. The latest numbers come as millions gathered for the holidays and students across Metro Atlanta prepare to return to school from their winter break. The CDC says it's too soon to say how severe this flu season will be, but the numbers show a rapid spread across the country. 7.5 million people sick, 81,000 people hospitalized, and 3,100 deaths. Here in Georgia, health officials are concerned, and our Nicole Williams spoke with doctors today about what you need to know if you get sick or your child. Nicole, do they have any idea what is driving the spike?
Well, it's the virus itself, Jobina, specifically the strain that's called H3N2, and it's really packing a punch for this year's vaccine.
Coughing, sneezing, completely worn down? Those could be signs of the flu. Health officials say cases statewide are surging. New data from the CDC and Georgia's Department of Health shows flu activity at high levels across Georgia.
We've had huge volumes in our urgent cares really since right before Christmas.
Since December 21st, more than 300 people have been hospitalized in Georgia with the flu. 2 people died. In DeKalb County, American Medical Response reports a 60% increase in flu-related 911 calls. Nationwide,
we saw 19,000 hospitalized patients from the flu, which was a 10,000 increase from the week before.
Dr. Andrew Thornton says the symptoms can hit fast and hard.
Rapid onset of fever, body aches. People often describe it as feeling like they got hit by a truck or got hit by a train. It's a very consistent description. It includes respiratory symptoms, cough, congestion, sore throat, headache.
Local pharmacies are feeling the surge as well.
I was open Christmas Day. It's not my holiday, so we must have filled 20, 25 prescriptions, both for kids and for adults.
Ira Katz, the owner of Little 5 Points Pharmacy, says customers are asking about the most effective treatment.
The nice thing about Zofluza is it's a one and done. And it's important if you're going to do Zofluza to catch it very early. So we have the generic Tamiflu, and I have the examples of the generic Tamiflu. This is the pediatric suspension. So that's nice because the Zofluza really is only, comes in a 40 milligram and 80 milligram, so little ones can't take it. So we have the pediatric suspension. This is definitely the most popular. This is the adult one.
For Chandra Ward and her partner, the flu cut holiday celebration short.
In fact, her sister and their entire family of kids, the father, were sick with the flu as well.
Thornton says acting quickly can help limit how severe the flu becomes.
You should see the doctor if you're in one of those high-risk groups, or if you just feel really ill, it's difficult to eat and drink, you feel really weak or dehydrated.
And Dr. Thornton reminds us that the home flu test can help us determine whether or not we have the flu. And the best thing to do is take meds right away as soon as you feel sick. Get plenty of rest and a lot of fluids and electrolytes. Jobina.
Okay, now Nicole, another question a lot of people have is how long people are contagious when they actually have the flu.
Oh, well, we're contagious for about 24 hours until you are fever free. So once you've gone through 24 hours, about a day, and you haven't had a fever, then you're probably not contagious. For most people, that's about 3 days. Sometimes children are sicker longer, especially if they have a weakened immune system, and the elderly, of course, as well. But no matter what, if you feel sick, you should go to the doctor if your symptoms are worsening or not improving, or you feel really tired, fatigued, and not able to eat and all those things. You should definitely see a doctor to make sure it's not too serious.
Yes, and stay home too, also.
That's right.
That's a big one. Nicole, thank you so much.